what was the last thing we did? You have the slide. What was the last thing we did? You know, there are two groups, so I always forget. What was the last thing we did, guys? Oh, you don't have the slides.
So we do.
Hello. Okay. So also, I know that the how do you call it? The last two times that we met, we only discussed research and promotion. I think health system was something that we discussed before. I don't know. I wasn't sure about the last thing that we actually discussed. I remember that we discussed about financial planning and all those things. So I don't know if we are done with that particular, so that we look at the financial audits. I don't know if that's what we have to look at.
So go back 1 minute. Let's see. I think we ended at we're about to start the financial audit.
Yeah, that's what I'm saying. That it's using the reports, and I am sure I talk about the accountability to the donors and all that. So I was thinking it should be the financial audit.
Yes, that's why we ended. We said when next time we meet, we start from here.
Okay, all right. Then I think that's right. Okay. So we want to look at the financial audit. And it's very simple. Today, I'm sure we'll close very early. Today is Monday, and tomorrow is holiday. People have to travel and then even go and look for some animals for tomorrow.
Salah, you know it.
So we are going to close very early. In fact, today I wanted us to just forget about the class, but the time is also going. So
Let's do small and go.
Small, so that we'll close.
Yes, sir.
All right.
The one who is supporting this agenda, I know he doesn't even want to come here. when I said this, it's like I was speaking his mind. I have spoken his mind 100%. So don't worry. Are you celebrating this Salah? The one who is saying, are you celebrating this Salah? And now we are celebrating this Salah.
First, are you a Muslim?
I'm asking him.
Oh, I will tuba tomorrow.
You, hey, when they're there because of
because of small meat, you have to buy tomorrow.
Even Chancellor Accra is there. Chancellor, you want to buy.
Okay. So let's look at the financial audits and pretty soon we'll close out to live here. So according to, World Health Report, that's 2010, World Health Report. You see WHR, 2010. I'll be talking about this all the time. An estimated 20 to 40% of health resources are being wasted. And when they say they are being wasted, it's not that people do not use it. It's corruption. They have put the money into their pockets. And sometimes they have developed a budget that they are going to buy a machine that costs 20,000 pounds. And they'll go and buy something that is 50,000 Ghana cedis and put the rest into their pockets. Or they'll buy a machine, they'll buy the inferior one. And then tomorrow they tell you that X-ray machine has broken down. Meanwhile, they say they have spent 20,000 pounds. So it's not that when they say it gets wasted, it's not that the money, no, it's not like that. Somebody has shortchanged the state or the health system or put the rest into his or her pocket. So there's always a need to do financial audit. So financial audit is simply the review of the books of accounts. and related documents at the administrative office. So review of books of accounts and related documents at the administrative office. That is simply about the audit. But if we talk about auditing, we are not only talking about money, my people. It's not only about money. Even what the money was used to buy, you need to audit that. Maybe if it's a construction work, you need quantity surveyor to quantify the money that they told you that they have spent on that particular project. The books that you bought, the medication that you have. So even the structure that you have in place, you have to audit them. So it's not always about only money. But it's because money that is what is used to buy all of these things or to purchase all of these things. Most of the time, our attention is mostly drawn to the financial aspect of it. But the main purpose is to detect compliance, whether people have complied with what the law has said about the use of money and use of resources. There are ways that if you are giving out contracts, there are ways that you need to follow. So are you following, for example, if you look at the Financial Act, Public Sector Financial Management, there are rules that you have to follow. There was a rule by 2016, it was even recently amended, Public Financial Management Act, where you yourself, you don't award contract to yourself, you don't have any conflict of interest and all that. Are you following them? So we want to know if you are following the rules that detect compliance, whether people are following the rules and regulations that govern money. When you collect money, it's not supposed to go into your private account. You don't collect company money, institution money, and put it in your private account. It's supposed to go straight to the institutions or the health service account. So fraud, as of fraud there, we know, is there plenty. We have auto fraud. You will buy a vehicle now, and they'll buy a new vehicle, change the, how do you call it, the engine, and go and put some repetitive vehicles engine inside. 2 days, 3 weeks, or 2 months after, they will tell that the engine is condemned. And then themselves will go back and buy that car auction. The whole vehicle pick up, they will sell to them 2,000 Ghana cedis. And they'll go and put the new engine that is supposed to be part of that particular car before they bought. They'll go room and go and put inside the using. And they buy a whole car, 1,000 Ghana cedis. If you think I'm lying, go and find out.
Wow.
So how do you know all this?
Hey.
And you learn, there are books that you read. You learn, and sometimes they engage you. Sometimes they will tell you to look at the. So you look at it. Sometimes they look at the car that they like so much. They themselves will go and this time change this thing and come and tell that it's spoiled. Sometimes nothing has happened to that car, but the boss like that car will write it off and tell one of his friends to come and buy it. And he's the one who's going to sell it auction, 1,500 Ghana cedis. They will say everything is condemned. The ties, the engine, everything is condemned. So he will sell it to the friend, and then the friend will buy it, and he will go and take it later. That's what they have been doing. So the waste that we're talking about, yes. Sometimes there are also waste in the system, apart from the corruption and other things that we talk about. Some of the things, they bought them, they don't make good use of it, and it gets them wasted, and nobody accounts for it. And people abuse the system. Abuse of the system, they are there, a lot of them. They abuse the system. Even the money that is not supposed to be given to them, they will arrogate those powers to themselves and award contract, give money to themselves, which nobody can talk about. You know how we abuse the system. Some of you know at your workplaces how you abuse the system. You know it. You go there and pick the drugs and say, oh, you are part of the hospital and all that. You go and take it and go and use. Sometimes people are looking for the same drug. You take it and sell for them, put the money in your pocket. Meanwhile, you pick it from the pharmacy because you are the one in charge. So when you talk, nobody talks. So you abuse the system to enrich yourself. There are people that every time they are conducting project, they will say they are doing this at the workplace. You can't even see the project, but the money is going. So when they buy 10 bags of cement for the project at the facility, 10 bags also go to their own project site. So by the time the project is done at the facility, they also have their house. So the project costs 10,000. Let's say it costs 10,000, but eventually the project will cost 20,000 because half of that money or what you spend on this, the same thing has been spent in his house. So by the time you finish constructing the project at the hospital, he also have his house and he abuses the system. So these areas that are looked into are the strategic and operational level. So you must look at all of this because these are the areas where the corruption is so high. So you need to look at all of those things. Then you look at the financial statement. The financial statement should reflect true and fair view of the business affairs of the organization. They typically include 5 basic financial statements accompanied by management discussion and analysis. We are saying that your financial statement should reflect the true picture of what is happening on the ground. What is happening at your pharmacy should be reflected at your OPD, the surgical ward, maternity, physio, X-ray, and all that. All of them should reflect in the account. If more people are coming and you are servicing, yet financial statement does not reflect, then you have to quickly think where the money is going and check whether people are printing their own receipt and issuing out and the money is not coming to your account. So the first one, statement of financial position. That is a balance sheet report on company's assets, that what is things that belong to the company, then the liabilities, your debts, or the bill that you have to pay, and the ownership equity at a given point in time. The one who built the facility or the one in charge of the facility, what is his level of what? Profit in that organization or interest. The equity, when your money, you put your money there, we expect your money to what? Increase, especially when you invest. We don't expect the money to be like that. It should always increase. So when you build a house and you are selling, it will increase. Some 5 years to come, your land that you bought today, it will appreciate and the money will increase. So if you bought a plot of land and you're able to buy it, so you spend 100,000 Ghana cedi to buy maybe 2 or 3 acres. Next 5 years, when you go and sell, you get close to 500,000 Ghana cedi or 200,000 Ghana cedi. It's not supposed to be like that. So somebody who also put the money into the business, the equity should increase, the money you earn in that area. So the asset of the company should also be there. Talk about the liabilities, that is the bill that you have to pay. Then the second one we talk about is the statement of comprehensive income, the profits and loss statement, report on company's income, expenditure or expenses, and profit over a period of time. So that also should be clear. Comprehensive income analysis or statement. What is the profit of the organization within 3 months or your facility? What are the losses? In fact, you are not supposed to make any loss. So when you are making loss, you know that somebody is diverting. Because when you are selling, you always sell your paracetamol to make some profit. If you are selling anything, services that you render, you always want to make. So where are you getting loss from? That means somebody is making more than he or she expected. So your eye has to open. Then statement for changes in equity explains the changes of what? Company's equity throughout the reporting period. So for the first quarter, what is the interest that has come on the properties that you have or people who has invested into your institution or your health facility? Next 6 months, what is going to be? 9 months, what is going to be? 12 months, what is going to be? Next year, what is? So you need to have statement on all of that. Then the cash flow, report on how money flow or the cash flow activities, particularly it's operating, investment and financial activities. So how is money coming to the company? Which way that money coming to the company? You identify those areas so that you can even improve better. So it's important that you must identify these areas. These 4 statements are very important. Look at the financial position of your company, comprehensive income. Then you also look at what? The equity, how the values that people put into your company or the money they use, how is it appreciating? Then you also look at the cash flow, how the money coming to the organization, the area that the money is coming from. Is it the OPD? Is it the lab? Is it the X-ray department? Is it the pharmacy? You look at all of that. Another issue that you also look at is electronic financial statement. These ones are better. Electronic financial statement is better because this one, anytime people pay into it and money is taken, you also have the record, update automatically. And if somebody has deducted money from the account that you know or already you suspect, you can quickly follow up and you know what actually is happening. So it is important that you also have this electronic financial statement in addition to all the four that we have talked about. So these are some of the things that you have to do when it comes to that financial audit. So we want to quickly look at expenditure tracking and reporting if you don't have any question on those things that we have discussed. So the national health accounts constitute systematic, comprehensive, and consistent monitoring of the resource flows in a country's health system for a given period. So the national health account, we are simply saying the money that you have in your account for health services. So if your national health account is not good, that means you don't have money to buy drugs and all that. It's not any specific account that you create to put money in. No, what we mean is that if you say national health account, we want to see if you have a very good balance sheet. There's money that you can buy drugs, you can buy machines for your health sector and all that. That is national health account. So we are looking at it, how systematic and comprehensive it is. Is it consistent monitoring of the resources flows into the country's health system for a given period? So you look at the resources that come into it. For example, if you look at national health insurance, we are saying that 2.5% of some products or some goods that are sold in the market, the money should go into the national health insurance. So you can later on check if the national health account is good to see if those monies are coming as expected. So a tool that is designed to assist policymakers in the effort to understand their health system and to improve health system performance. Because if the money is coming, you can actually know how to improve your system and also actually encourage or improve performance to help you to stay afloat and provide services to your people. So national health accounts provide evidence to monitor trends in health spending, the money that you spend in your health in all sectors, public and private, different healthcare activities that you need to have, reproductive health services, surgery, medication aspect, pharmaceutical and laboratory issues. Then providers, the diseases that is covered, and then the population growth and the regions within the country. You identify the disease attack in various regions, the providers within various regions, the care activities in the country, and then general population at large, so that you know where the money is going, where the money that you have as a state or as a country in your health sector is being spent, whether it's reproductive service that is taking so much money, or non-communicable diseases, lifestyle disease that is taking a lot of money from your health account, or what do you call it, communicable diseases. You look at all of them so that you can strategize in going forward. So the importance of national health account is that it provides policymakers with information on the volume and the sources of financial statements or resources for the health sector. So clearly it can give you the policymakers in that area will give you information where the resources are coming from, or financial resources for the health sector. Are they coming from national health insurance? Are they coming from voluntary organization or the government expenditure or the budget? Or is it coming from philanthropies that are supporting, or donor budget? Is it coming from World Health Organization, World Bank? You all, that will give you information so that you know how to plan going forward. For example, when we move away from the low income country, and now we are in what? Middle income country status. The World Health Organization is moving away from us. The World Bank is also moving away from us. There are some budget support for us when it comes to TB, malaria from the Global Fund. They said they are going to reduce that because one of the issues that concern that fund is that if a country attains middle income status, they have to win them so that they have to fund their own budget. So now that we are saying that we are in a lower middle income country, or we are in that status, a lot of these accounts are being withdrawn from us. So it is becoming difficult now to get support from the Global Fund to support HIV, tuberculosis and malaria, because we have attained. So that will help you to develop strategy ahead of time to be able to meet your demand. It also helps in developing national strategies for effective health financing and also raising additional funds. So you can identify areas. For example, we said that the national health insurance is not sustainable. So what do? We have to engage in fundraising or levy some institutions or those who are giving us the health issues. We will put some money on these soft drinks or these fast food so that we can make some additional money to support the health sector. Or sometimes we can raise funds through individual contributions or donor support and all that, or bilateral relations between Ghana and other countries. So regular updates of the national health account facilitate reviews of public and private health expenditure, help to monitor and evaluate the country's health system. It gives you which areas of the health sector you spend so much money on, which disease is taking a lot of money from you, so that you can plan and see if there's a need for you to come with health promotion and education, so that at least you can reduce that disease condition. The information can also be used to make medium-term financial projection of a country's health system requirements with the past or with those of other countries. So the information that you are getting from your financial areas, that is your national health account, can also help you to compare your country with other countries within your sub-region and see how well you are doing, and also the requirement that you need to be able to achieve all of that. So all of these are very important that you identify them and then try as much as possible to help you to resolve them. So the national health account is good so that it can give you the information about what is happening within your health system, and that can also help you to manage your system. However, there are challenges. There are challenges with the national health account.
Hello,
yes.
Sir.
Yes.
The national health account, who is responsible for monitoring or supervising the account?
Yes, mostly about the health minister, and then we have the planning department, human resource, director of finance, and all that. So they actually determine, and then by now part of the world, is the government of Ghana's budgetary allocation to the Ministry of Health. So that's one we can say that in our part of the world is mostly about government of Ghana. So it's government of Ghana that allocates money to the health sector. However, the minister is also the responsible.
Hello, sir.
Yes.
Please, you said the national health account is not any special account that has been created. Does it involve the internally generated fund of the various facilities, or only the money the government, the budget for the health sector?
Well, at individual level, the question you're asking is at the individual level, at your own facility. When you are looking at your national health account, you are looking at the money at your level there, at your institutional level. So include your internal generated fund, how you want to use to improve upon healthcare delivery at your facility. But if you are looking at the national level, we are just looking at the money that the government of Ghana allocate to what? The Ministry of Health and then to Ghana Health Service for healthcare delivery.
Okay.
For example, you see recently the World Bank has given us, is it $200 million for us to buy COVID-19 vaccines? Did you see that recently? Yeah. It was last week.
Yes, sir.
Yes. So the minister can monitor how much we have there as our health sector. What are the money we have, so that we can use this money to buy them. But when you come to your individual facilities, it will include the money that you are generating, because all of that will give you fair idea about how much you have in your account as a facility.
All right, thank you, sir.
Okay. So the challenges, yes.
So please, I would like to find out, like, the various health sectors, when payment of medical bills is being done, how is it being gathered at the national level? Or let's say Kolebu is there, when payment is being done, like they have different bank accounts as maybe compared to Confanoche. So how are all these funds being gathered together, and where does it go?
If you say the funds, I want to get that clear. Is it from government or the facility itself?
I mean, yes, from various hospitals, like individual hospitals or health sectors, because each hospital has its own bank account that payments of medical bills are being taken.
Yes.
Yes. So how is it being gathered together, or like every hospital is being managed on its own in terms of their money or their bills? Like, I want to know, how are all the funds being gathered together nationwide, and where does it go to?
Yes, when mostly the money that you collect as the bills. Sometimes what happens is that most of these facilities, they go to the central medical store for their drugs.
Okay.
And when you bring them to your facility and use them, you yourself, you add some money in selling to the public. Then you also make some profit for yourself. And then you go back and pay that money into what? The central medical store account. So that money, government use it again to buy the drugs for onward distribution to you, and you take it, you pay back. But when you look at the various facilities, they all have their own account that they operate. However, government have budgetary support for these facilities. So government devote that this year we are going to spend this money on, let's say, this rich hospital, regional hospital. These are the money we are going to use to support them. So that those monies will come into your account, especially when it comes to a payment of workers. Those ones, government actually take them up on itself, so they are paid from control and all that. But your accounts that you have, government's budgetary support come in, especially if you talk about Kweza ones like 37 military hospital. If you look at it, all the officers who serve in the Ghana Army, they don't attend hospital here and pay money. You have to continue until you die. It is when you die that you know you won't come here again. But so far as you serve in the army, whether you retire or not, you have to enjoy services free of charge. So there's money that government have to vote every year to support the hospital. Because there are people that are entitled, they are not paying for the services. Government has to pay for it. Are we following what I'm saying? So government have to vote some money all the time to support these facilities so that they can continue to provide services. So government has to provide some amount of money to support their activities. However, the internal generated fund, it is left with management to decide how much or what they are going to use this money for. However, I will not be here to say that I know everything, because government has come out with a strategy that if you raise internal generated fund, you are supposed to spend some of them, and part of it are also supposed to use to support your activities within the organization or back to central government. So there are ways that are being done, but depend on where you find yourself. There are different modalities that accompany how those monies are spent. But what you have said in what we want to establish is that every organization or every institution or every hospital have their own account. They don't have a central account that everybody pay into.
Thank you.
Any other contribution or question? So we look at the challenges of national health accounts.
Hello.
The danger of, yes. Do anybody want to ask a question? Or we can move on. The danger of having parallel health accounts where harmonization with national framework is difficult. So when there's a challenge where you have a parallel account, that becomes difficult for you. You alone, you have a facility where you have about 2 or 3 accounts. So when it comes to time to harmonize, to see your level, to see your health status, that is your financial status, it becomes a challenge. So you need to have just one pool account and where all the monies are there, you know what is coming to you. Also building disease-based national health account due to a donor funding. You know, how do you call it? TB, malaria, HIV, and all that, they have donor funding. That is from the global fund. So those one you need to have accounts for it, specifically disease-based account, national health account. That all the monies and resources are in these particular areas. We are going to devote them for what? These particular diseases that have donor support. For example, the how do you call it? Donor fund. The global fund, not a donor fund. Sorry. So take that particular correction. It's what? The global fund, which was established by Kofi Annan when he was UN General Secretary. The global fund supporting what? HIV across the world, TB across the world, malaria across the world. So those one, when they come, they are at the national level, Ministry of Health and Ghana Health Service. So you must have a specific account for those ones so that you know where they are going. And you are not supposed to use money from those accounts for any other service. They are for those particular areas. So when you divert them, you remember we saw a slide where you have to be accountable to the donors. So what you use the money for, you must account for it. So that is also there specifically. The estimating cost of illnesses, especially outpatient and the chronic conditions. how to estimate those costs so that you can meet and know that we can raise this money to be able to cater for this is always a challenge because things are changing. For example, in 2020, nobody expect that we have what? COVID. Even though we started hearing the news in 2019 in China. We have not prepared for it. Look at the kind of money that we have spent. People donate money to COVID fund. More than 70 million Ghana cedis. All those money, I said 70 million, or close to 100 million Ghana cedis. The money was used within 2-3 months for PPI and all those things. So those one you have not planned for it. So it's always difficult to do your estimate or get your estimates right because you don't know what is happening tomorrow. As we are here dealing with COVID now, maybe next year another thing will come. So it's difficult to also have the estimate and cost estimate for those diseases that are likely to appear in your outpatients or chronic condition that you need to resolve. Challenges or estimating household expenditure. The household expenditure as your country's total cost is also difficult for you to indicate that what people are going to spend their monies on. As a country, it's difficult to come out with a strategy and identify that, oh, people are likely to spend their money on this. You are not the one who is going to do that. So it's always difficult to determine that. The differences in the modes of delivery, making comparison difficult. The services that are provided at the chiefs district hospitals are different at the national levels. And at the same time, the service even treating malaria. When you treat malaria at let's say chief compound or district hospital, the money you are supposed to collect for it is different from when you treat malaria at the regional hospital. I'm sure you know all of those things. The money you charge for treatment of malaria at a district hospital is different from when you are treating the same malaria at regional level. The money differ. So sometimes because of those differences, it's difficult to compare them. Then differences between physical and a calendar year records. The fiscal year, we are talking about budget. That is the fiscal year. That is the money that you have, the budgetary allocation for that fiscal expenditure vis-a-vis your calendar year records. So sometimes by the time they approve budget for your expenditure, we are in March 31st. Meanwhile, the calendar year ends December. So how do you correlate the 3 months that you have spent already? How do you correlate all of those things? So it becomes a challenge to compare them. Then the difference is also, the distinction between types of insurance is not very clear. The types of insurance that you have that people also assess, maybe community-based, private-based, work-based, and all that, also create some problem for you to know exactly how much you can get in your health account. Then sustainability or difficulty to capture international trade in terms of what? Healthcare. Those ones are bigger issues that I don't, if you want us to draw into it. The international trade that we are talking about, the import and export, cocoa export and all that. What kind of money from those services or that international trade that come to healthcare delivery? The sustainability of a national health account is a challenge, only done because donors fund it. Sustainability of it is challenge. It is